show. Slides. Is my slides are visible? Hello.
No, sir.
Okay, then again I will make it entire slide. Share you. Okay. Now slides are visible.
Yes, sir.
Okay, fine, good. आज का जरा प्रोग्राम बहुत अच्छे से आप समझ लीजिए कि that is a very important factor in clinical sexology. That is my total depth of sexology, and it is gifted from my all the students. Though you are attending, you are added some information, and we go on adding the our sexology curriculum. Okay, we will start now, my dear friend. Slideshow. We will go from the current beginning. Okay. Sexology for medical doctors. And this program is affiliated to our Indian Society of Sex Medicine, and along with this, CTA, and I'm a certified sexology doctor of the American Board of Sexology, and as well as I'm also a diplomat of American Board of Sexology. I'm attached here in Pune, D.Y. Patil Medical College as an assistant professor, and I'm also attached here in and started the sexual medicine OPD in Pune in Aditya Birla Memorial Hospital. And this startup, when we start the story about it back, and we register it as a startup, WHO Healthcare Private Limited, that we are registered in WHO Healthcare Startup. And that is a government recognized approval certification. We got it for conducting the various program, what educational program, along with this some molecules we are going to prepare to remove the side effects of the medicine. That is a basic idea behind that, to make the allopathic medicine in the homeopathic way and see the results on the various chronic diseases. It's like a few drugs are prepared. One is antacid is prepared. That is a ranitidine, and ranitidine is given. That is effective. So we are thinking that those who are having a more side effect, we will do it, but we are not in practical scalable project. So we keep it as a dormant one, and we are active in the educational programs. Now soon we are going to form the pan-India basis franchises. We are giving free of all our colleagues. Only registered charges, like government charges of registration 5,500. Those who want, they can join it, and that will be effective in such a way, sitting at your own cabin by asking your assistant, a receptionist, whomsoever, you can join with the wellness program. That is a wellness program, WHO wellness program of preventive healthcare. That is a reversible of diabetes, reversible of blood pressure, reversible of obesity, and boost up testosterone naturally, and reduce the PCOD cases for lifestyle modification and so on. Here we are not charging. This is open to everyone, those who register under our franchises, for free educational program. That is under the Sunday meet. We are getting very good, and 70 people show their interest, and soon we will reach to more than 500 pan-India base. If you are willing, when you are here, you can join, you can fill the forms, or you can join directly. Don't worry about that. This is the first hospital. The idea comes whenever patient comes to us for erectile dysfunction, is much more, because there is no standardization. most of the time patients don't want oral pills like a Viagra or phosphodiesterase, sildenafil, tadalafil, vardenafil, udenafil, and so on. Still, the best drug is sildenafil, most effective. Now, what you do in your clinical practice, whenever you prescribing the sildenafil, don't prescribe in the tablet form, prescribe in the film form. And so that will absorb very fast. Oral pills, oral film is available. 2, 3 companies manufacturing, and you just search, you can get it on the various platforms is available. And that is for 2 hours before intercourse, 1 hour before intercourse, SOS, because it's not cure. What is the cure then? We are going to see in details various applications, various hands-on training program we added, shockwave therapy, P-shot therapy, that is called PRP, and meridian stimulation, and so on. My dear friends, here are some shockwave therapy gadgets we are using most. It's available very frequently. There are various gadgets are available. Now, again, our doctor colleagues are confused what gadget you should buy. Whether you go for 35 lakhs rupees gadget or portable around 3 to 5 lakhs or 4 lakhs, that depend upon you. Both the gadgets having a similar effect, similar results. So that choice is yours. And we also, those who can't buy, then we have developed very simple gadgets, hardly costing about $150 to $200. That is around 15,000 in the market. And this is a prepared from meridian stimulators with the, because everything, whatever inside the body is reflecting by the reflecting on reflecting. तो तू मला घेऊ नको, ते देऊन टाक, मला नको देऊ काही, तू नंतर हिशोब दे मला. I'm pretty लिखते, don't disturb me. Sorry. Whatever the insight, how is this? I will explain you. Just give me 1 minute. That is a Chinese medicine. Here you can see the body. This person having various lining on this model. You will get it. The lining, the kidney meridian. Remember only kidney meridian and urinary bladder meridian. You go on stimulating it by pressure or by electrical stimulation, by needling. But don't do the needling, go for this gadget, that is the electrical stimulation. And ear representing the whole body, you can prick on the ear or you stimulate the ear, the sex organs get erection soon after the practice. So a patient has to do it minimum 20 to 30 days, with 3 to 4 weeks for the meridian stimulation therapy. Now, my dear friend, we go ahead step by step. PRP is nothing but the platelet-rich plasma. Very simple. You have to take 10 to 20 ml of the blood of the patients and add it in the 2 tubes with PRP separation solution. You name it ACD solution or PRP separation solution. And then rotate it, centrifuge for 15,000 repetition for 10 minutes, then about 250 rotation for 10 to 15 minutes, and PRP will collect it, concentrated plasma, and that is injected in the penile shaft after the penile block. You have to learn here how to give the penile block, where to inject. This is injected in the corpora cavernosa, not in corpora spongiosum. This is the only you have to remember. When you want injection papaverine, then that is given in the corpora spongiosum. But this is the only difference you have to remember here. I'm not taking your much time, but whatever basic things I want to know, you should know it. Is a sexology, is a basic in sexology. Every person is sexual. Whenever patient comes to you, don't say you are not sexual, your power is lost, you can't do it. That gives them bad impact and psychological impact, and patient goes again, fall in, and no medicine works in such cases. So please, every person is sexual, but you have to find out whether it is by love mapping, whether it is a state or gay, that you have to know. Means state with a heterosexual. They love opposite sex. Those who love the similar sex, these are homosexual. Male is a gay, female is called lesbian. This is the only you have to remember here. Love map is the first time we introduce on the request of our students. That is also very good for doing case taking. You add on, sir. Love map is a mental pattern expressed in every individual sexual life, sex erotic fantasies, whatever in there, and practices. It is unique for everyone, hence sex education is fundamental human right. It is developed before the age of 8 years and is executed after puberty. Children get their love map by engaging in sexual rehearsal play. When the play is not interfere with by parents, is not stopped by teachers or by society, the love map develop as heterosexual. Otherwise, they are confused whether I'm a homo, or I like male, or I like female, like that. That is the what suggested by psychosexual stages according to Sigmund Freud. He's a great neurologist and psychologist both. And he said after the birth of the baby, psychosexual development start in five sexual stages. What are these stages? Oral stage, anal stage, phallic, latency, and genital stages. These are called psychosexual stages because each stage represents the fixation of libido. Public sex drive. What is libido? Sex drive. That you have to understand in each and every case when the patient approaches you. Where is the sex drive? Sex drive is towards opposite sex is a heterosexual. Otherwise, he may be fall in homosexual. Then again, you have to find out it is exclusively homosexual or is the bisexuals. Whether he may perform with a male or opposite sex or same sex, like that. Now, session one, what we include in session one, values in sexuality. That's just how I told you. Don't say any patient, your power is lost, you have no sexual performance, nothing like that. But everyone is a sexual. But you have to find out whether it's straight or gay. Now, anatomy and physiology, we are going to see in our further slides. Psychology of sexual response cycle, neural mechanism of sex, hormones in sex, sexual problem, history taking, physical examinations, and investigations. In session 2, we covered counseling, psychotherapy, sex therapy, sensate focus, pharmacotherapy, coital postures, man and woman similarities and differences, what man want, what woman want. Very, very important. You have to know what they want. Mostly the female want caring, loving, getting more presentation, get gift, and all these things. Who loves female? If you learn how to love the female. Otherwise, if you don't understand, only simply if you are married couple, only go and start hug every day whenever you start from your home, so that whole day she will be remains for you only. She will not go here and there. She will remain because this attachment with the female, they are very romantic, very emotional, and very soft. So you have to understand, and the psychologist said there is no ideal couple in the world, no ideal spouse or ideal husband. You have to make the relationship ideal. Here you have to asking your patient to have a hug or one kiss, whatever he can do best. What man and woman wants, personality evaluation, we added, very important to know the persons, whether it is a powerful, popular, peaceful, and perfect. According to mismatch their personality, they may feel that they are against, they don't like. So this is the way you can have. We have the assignment for that personality evaluation that will helping you couple counseling or relationship counseling, pre-marriage counseling, post-marriage counseling, and so on. Session 3, we added masturbation. 96% males are masturbating worldwide and 76% females are masturbating. Homosexuality, just same to same sex, similar sex, similar person, male to male, female to female, like that. And oral and anal sex and consummation is very common. Married couple, but they can't perform because of various conditions like a psychological condition like vaginismus or dyspareunia due to the fungal and bacterial infection. You have to find out, you have to treat accordingly with antibiotic and antifungal treatment. If not cured, then consummation is psychological, is vaginismus, and it needs some psychological counseling. Along with this, you have to use lignocaine jelly with dilators. Male infertility, we are going to see the sperm count, whether it is a sperm count oligospermia or azoospermia, 0 count, then azoospermia, oligospermia, maybe sperm count is 5 or 8 or 10. That should be more than 20 ideally, and more than 40 is better. This is the way oligospermia you can treat very well with fertile tablet. Fertile tablet is nothing but a chromipene citrate. Give them every day, 5 days in a week, or every day you can give for the 3 months for the male partner. Myth and misconception, number of things, size, about the size is very curvature, is taken. Law of masturbation because of loss of semen. They have myth and myth in their mind. You have to clear it and pick the patient. Frequently asking question, FAQ, you have to ask, and hypoactive sexual desire. There are thousands of FAQ we have collected so far. We will discuss when you are here more. But in this hypoactive sexual desire is very important things. Most of the time, complaint by the partner that my partner is frigid, low libido. How to increase the libido? One patient, female patient, called me, sir, I want to consult you for sexual course. Well, what, you are doctor? Because I was thinking it's a psychologist or doctor. She said, no, I want sexual course. Well, this is not the profession. We will teach you, we will provide you as per your partner symptoms. Well, I am not married, but had the relationship. My age is 32, and the frequent. But everyone said you are not sexually. You are frigid. So this is the story which that the things foreplay sensitive focus is a main role to teach your partners, and clitoral stimulation to be taught to the male part, and caring of the female part is very, very important factor. Male erectile disorder importance and premature ejaculation is very, very common. Every case coming here having a premature ejaculation. What is the premature ejaculation? The erection not sustained more than 60 seconds. That is 30 seconds, 20 seconds, and ejaculated fast is the premature ejaculation. How to control? Again, some exercises or lignocaine jelly to apply on the sensitive glands. Now, my dear friend, session 4. We have taken these classes, but most of the time you are may present or may not. That's why I want to complete this in a single talk of today's masterclass is male orgasmic disorder. Just like a female, male also having a low libido because of his organic cause, again, diabetes, blood pressure, and any other cause. Overweight, more estrogen secreted in the male and testosterone reduce. You can improve. Our Sunday meet program is only for that preventive healthcare, reversal of diabetes, blood pressure. Once in a week, patient has to attend, and 6 weeks they have to perform as per our videos uploaded. We again send the link to those who want, and this is the way we want preventive healthcare so that we can improve our economy to reduce the drug cost to the patient. Because if I can, my case, I visited 4 5 cardiologists, and everyone is changing my drug, but my resistant blood pressure not controlled. When I do some lifestyle modification, pranayama, meditation, along with this diet, and reduce 10 kg weight with the proper uh, dietic program, the short restriction and other things, and improve. If this is happens, then why not? If this is happening, the doctor, qualified doctor, will can't have to go through 4 to 5 years with no. So if lifestyle modification help them lot to cure the patient. So medicine will reduce. But you can now everything reversible according to me. All the chronic diseases are reversible, and all the diseases are most of the psychiatrists worldwide saying root cause of each and every disease is the mind. In our previous oldest science said it is called adi. When it is precipitated on your physical body is called badi. Means somatic disorder, psychosomatic disorder is a term arise. Each and every disease there is role of psychosomatic disorder. Then how to control it, how to improve your positive energy to cure yourself, that you are going to learn in Sunday Meet program. In new case or what is saying? चलो ठीक है. Okay. Now we go ahead. Practical assignment is very, very. Our first institute, we added, I can do the best because of you. Because everyone suggested me something, and we go on adding everything. And we approved our syllabus by the institutional, under the institutional membership of American Board of Sexology. Previously, American College of Sexology, now American Board of Sexology. Now, my dear friend, diet is a very, very important role. If you overweight, then low libido, erection problem, abdominal fat develop on the male. Man boobs comes, decreased muscle mass, constant fatigue, lack of focus, depression. Reduce your weight. See, go start your gymming. Start on walking 10,000 steps. Burn out your 500 calories per day so that you can manage and take 500 calories less intake. So simple formula to reduce the weight. And eat whatever weight. Suppose my weight is that time is 80. I started 800 grams of salad, 400 morning, 400 before lunch, 400 before dinner, and 400 fruits. Fruits, low glycemic fruits mostly. I added apple and other things in the fruit, papaya, apple, and all. And you can choice accordingly. You can do it, and that will help a lot. Assignments, we have also give the assignment step for good health. What did what according to your diet prescription, physics, step for physics, step for stamina. That is very important. Assignment for personality evaluation, APTQ, is very important. We must go for minimum 50 to 100 personality evaluation in your family and find out their personality by questionnaires. There are 40 questionnaires we provided you. You just send to your patient and ask them to write down which you like best. Answer one is compulsory in every questions. So there are 40 questions, 40 marks. Then you can find out which questions belong to where they mark, whether they mark in powerful, peaceful, or perfect personality. According to you, there is a scoring chart. That chart is for you, not for the patient that keep with you. And according to you can advise them, oh, you are powerful, means you are you are very fast, you get more anger, so you need calm and quiet. And for that meditation and all, this is where you can advise them and treat your cases. Fourth assignment, finally we give you MCQ. We already send you MCQ, whether you solve or not. I don't know whether you are doing, because everyone wants spoon feeding. Sir, आप ही करवा दो, आप ही कर लो यार. बस हमको सेक्सोलॉजी का डिग्री सर्टिफिकेट दे दो, बस that we want. That is not our aim and object. Our aim is that you should do your own and do the best to the society. Best is, if you want everything, we have given the various books. Everything is mentioned. This is everything in my book slides. And then this is a fifth assignment where you vacuum medicine. Every case you can. We added our penile doctor. That also we will show you here. You go there, keep the penile doctor, keep on vacuum medicine device, keep at least shockwave therapy made if possible. Then for female, vaginal tightness is very, very important because of uh, premarital, most of the times having a sex in a corporate sectors and all, and they need it tightening, and the females come for that. So you need the non-surgical vaginal tightening, hypo, means high intensity is ultrasound is penetrated under the musculature, and this get contracted and tightness increased in the muscles, is increased. Erotic zone stimulation, again, erotic zone stimulation is nothing but whatever I suggest you, kidney meridian and urinary meridian flow according to TCM, traditional Chinese medicine. You can take reference from there, or otherwise your ear representing the whole body and nose is representing whole body. Everything sensation, everything part from nose. The touching of nose is very, very important for sensual, sexual, and romantic stages. So that you can add on in your case and advice. Now, papaverine injection here is the ready-made available, but some are teaching you how to make the bimix, trimix. Otherwise, bimix and quadramix and trimix available in power pharmacies mentioned, because very few pharmacies are manufacturing. But that injection should be given in the insulin syringe. Insulin syringe, make it start with the 20 units only, but don't increase, and it is given into the spongiosum 2 o'clock or 10 o'clock position of the penile shaft, and just get it, insert the syringe, and then just pull suction, what you can say, pull it so that, or suck it, the blood is coming, means you are in the right track, and give the injection, and you get the erection within 5 minutes, 10 minutes. That is also needed during penile Doppler test for radiologists for evaluation of vascularity or blood flow test in the penile shaft. Now, procedure for papaverine, very simple. Injection, bimix. Don't use direct papaverine because it gives the fibrotic conditions. But one injection, two injection, nothing as a fibrotic stage, but you can dilute with various bimix, trimix solution is available. Now, I'm not using, because this should be used very carefully, and otherwise you have to keep the patient 2 hours in your custody. If there is a priapism, then you have to remove the blood. Otherwise, it's a medical legal case. Stem cell therapy is very simple. Stem cell therapy, everyone can do it. Now, most of the time, antibiotic retroverted, when the patient is fertility issue. Fertility issue means everything is normal, but the can't conceive. In such cases, you find the position of the uterus in the sonography, female part, no doubt. But if it is a normal, then normal poses, you can do it both. If it is a retroverted uterus, then doggy pose. If anteverted, keep the pillow behind the back, keep the pillow inside back, and have intercourse. Sensate focus is nothing but the step by step, 4 plus stages, one by one. You can do it gradually. Same thing outside. We go on the back side. Now, LM potency also we keep it our one treatment is nothing but a what you say nano base of diluted homeopathic LM. LM is 1 into 10,000 dilution. That is prepared in the mineral water or water base, and you have to put the globules, which medicine you selected after repertorization. We have the repertorization unit. If you are willing, just see this. When what will use it, that is secondary. Whenever you feel it's a good things, you can try, you are getting results, then you can add on these things. Because first I was saying the homeopathy previously as a placebo. Now I'm saying that it is not placebo, it is a curative medicine. But if you select proper medicine, if you selected and if you provided to your patient, 90% patient comes performance anxiety. And according to me, my experience saying homeopathic works here very fast. And long lasting result means a patient come after 2 years, 3 years, like that. How to go that medicine and find out, we are going to discuss when you are here. And few medicines you just remember that list we will provide you. And few background remedies also we will provide you. Online training goes to homeopathy. Okay, homeopathic. This should be because we have the multi-therapeutic. We take all the doctors, homeopath, allopath, Ayurvedic, and counselors can't prescribe the medicine, but they can do other therapeutic counseling programs. Homeopathic cure the disease from the root. Homeopathy works on the theory of individualization. Homeopathy is easily accessible and tolerable. Homeopathy boosts the immune system naturally. In COVID, we use arsenic album to boost up their immunity. Homeopathy is safe with other medication. Previously said homeopathy cannot mix with the allopathy. Now we are giving both together. You can mix with medication. Homeopathy help with acute and chronic cases. And you cure most of my asthmatic and chronic illness like sinusitis, rhinitis, headache cured in 2 or 3 dose only. Not needed to continue the dose for years together. Only needed for 3 to 4 months therapy. 90 to 120 days because all the cells replaced to new one or died, and homeopathic have long lasting results. Energy, we are teaching you how to feel the energy, how to use it. What we are doing in shockwave therapy, providing the high intensity, low intensity shockwave therapy is nothing but energy provided to your vibration to your vessel to remove the or revascularization of corpora cavernosa, the upper layer, corporal layer. We are not reaching to down inside. We are not advised to provide it to the testes, otherwise you can damage. Now, various mantras, activations, we told you, whatever you are doing, the various psychic centers is stimulated with mantras, right side and left. Whenever you want to know which nadi is working, just keep the triangle of your this hand. Now my flow is more left side. Left side means Ida, right side is the Pingla Nadi, work for 45 minutes, and then work to Susmana like that. And all the interchanging means left side indicating cool effect, moon Nadi. Right side is a hot anger, and everything is. Suppose your patient comes to you and always complained by the other partner, female partner, कि घर पे आते बहुत गुस्सा करते हैं. Ask them to start their moon nadi. So simple. How to do it? Very simple. Some techniques are there. Otherwise, I want to open my left side nadi. Then I do lie down on the right side, and this nostril will clear up, and you get the this triangle will reduce. These are the techniques of again Rechak and Purak. Rechak, Purak is the pure oxygen inhalation, and Rechak is exhalation. That how much do the exhalation? And your breathing rate is mostly 60 to 18. Sometimes it increases to 20 or 30 for asthmatic cases. So their lifespan will reduce if your respiration rate is increased. So always see a caso, tortoise having only breathing 5 per minute. Even you can see elephants, there is 7 to 8 breathing per minute. Their life 100 years. Tortoise life is 200, 300 years. If our Rishi Muni was doing these all pranayam and they stay around 200 years because of controlling their breath, that we are going to teach you in Sunday program. It is for this third session. Everyone is giving me and appreciating me and motivating me to continue such type of program. So far, I can do it. This is the totally free. Anyone can join. We will send you link. You can join. If you can't, if you have anyone having a blood pressure, diabetes, ask them to join. They will get motivated. They will cure themselves. That we want. And then this mantra is Om Ham. This mantra's effect on that vibration and energy is released, and this energy is provided just like a TENS or EMS, what we explain in the meridian stimulation. Now, zero volt therapy as an electron balance. There is a mat is available on Amazon. You can find out and keep your legs without any shoes, without any chappal, and for minimum 2 to 3 hours. That will help to increase the electrons, and that will cure your disease, according to this zero volt therapy, electron therapy, grounding mat. Now, counseling parts, there are various type of counseling. Systematic desensitization, cognitive behavior therapy. We are going to take this. PTT test, acceptance commitment therapy, rational emotive behavior therapy, problem solving therapy, so on. Assignment on NLP and sound healing also included. Combination with meridian stimulation. Sexuality is a natural intelligence and is a part of living. All persons are sexual. Sexuality includes physical, ethical, spiritual, psychological, and emotional dimension. If you want to cure, you can't cure only by medicine. You need psychological, spiritual, physical, and ethical also. Very important. Every person has a dignity and self-worth. Respect everyone. That includes everything. Their personality, body image, values. Because sometimes I don't like nose of my partner. I don't like the height of my partner. I don't like hair of my partner. Like that, you have to make. When you married, means you are accepted. You like it. You have to keep your word and we continue life. Or imagine someone and do it to your partner. Nothing wrong. Now, anatomy, physiology. Here you should know when you come for hands-on training program. program, there is corpora cavernosa outer. And here we have to inject PRP solution slightly. The needle is not given deep, straight, but slight. And then corpora cavernosa, three, four sides, around 4 to 6 ml. You can inject. Mostly patients happy for after 1 week or 2 weeks. Their erection, early morning erection improved. Along with this, you give them 2.5 mg tadalafil low doses to increase the blood flow more, and that will happen. And shockwave therapy will improve to reduce the calcium and other parts removed from your blood vessels, osteophytes, and other things. Those are atherosclerosis forming formation removed from the vessels and increase the vascularization therapy. Is shockwave therapy, PRP is a growth therapy. The combination of both is very good and advice when everything is fair. Anatomy is over, my dear. And we cover everything so far. Now we are going to cover further. Something you missing here is that most of the time patient comes to you, keep such figure or paper or on your table so that you can say your partner go for clitoris stimulation. Clitoral stimulation is a very important factor because when the baby in the womb of mother, sex organs, that whatever tissue required is nothing but the phallus of ectoderm. If it is a tube-like, then is the penis in the male. Similarly, that tissue form clitoris in female. Means clitoris and penis, representation of the penis is the sex organ in the female. Orgasmic organ in the female is the clitoris, not the vagina. Vagina is just like a tube passing the penis to have the sperms and all to for this thing. But the real is the clitoral stimulation. That is very important factor. That you should know. That's nothing. So simple. Now, anatomy, physiology, or psychology of sexual response we covered it just now. Love mapping is over. Same thing is again. Oral, what the Freud's psychosexual development stage is 0 to 1 age. Oral, whatever happened oral. Baby learn to enjoy the pleasuring from eating and vocalizing. 1 to 3 anal pleasuring from retention and repulsion of feces. Very important. The baby learns and enjoy, and 3 to 5 years phallic. If something is happened wrong in these developmental stages, that will affect in adulthood for getting or boost up desire, increasing libido, problem of low libido because of this. So these things should be developed properly and having these things. Okay, that is a more identical with the same sex. This is all given this psychosexual development in a 0 to 8 year age is very important. After 8 is love mapping and all. And that is done, then you know that some psychological aspect, because there is nothing particularly scientific, because everything is normal, all hormones, everything is normal. But why patient act like gay? Why patient act like lesbian? That you have to do. And this is not the disease, this is just like a condition, and let them remain in same stage. You can't change by counseling. Now, my dear friend, I'm not taking your much. Sexual response cycle is developed by William Masters and Johnson, Virginia George Johnson. First, before 1966, everyone felt that male are active in the sexual act and female is a passive partner. And after Master's Johnson's research work in the laboratory, working with the 382 females and 312 males group, and their all photometric studies in vaginal secretion, other secretion, other developmental body changes, he said equal desire in both. Male is equally partner in sexual act. Don't that the way, and then the concept change about sexuality, woman sexuality. That is the basic of Master Johnson's. Now everything you know, the neural mechanism of sex, sympathetic nervous system, lower lumbar area is stimulated, and sacral area stimulated and controlled for erectile dysfunction and premature ejaculation. By TENS, you can use it. You can ask the patient to buy this TENS machine and do it at your home and see the results. Most of the my doctor colleagues, my students says, sir, is very fantastic. You can buy even cheaper unit, not needed you acupuncture unit and other things. Not needed here, then it's costing around 500 to better unit, 10 to 15,000 rupees. Detail about sexual response cycle is over. Now here one thing I like to add, now you know female having a clitoris outside the body. So clitoral stimulation again and again. The female get orgasm after orgasm. Why do females are frigid? Because nobody stimulates their clitoris. Try to stimulate the clitoris of your partner. Then she will be always active. And we forget we are behind the low libido, low libido medicine. We are discovering that what medicine they should take, what herbal. Don't go for that. Only clitoral stimulation will help a lot. And male has to number of things. They get erection if they ejaculate faster, emotional control, everything. Here, female is nothing because everything, even by talk, female enjoy sexual talk, and they get. That is the neural mechanism of sex is over. And stimulation therapy, I suggested you can use the various gadgets. You can see here we will use gadgets. We kept 5 cases for you for the PRP, 3 cases, and shockwave almost 5 to 10 cases, and then meridian stimulation. Everything we will do that time on patient. Hormones in sex. You know the testosterone is the male hormones. Estrogen is a female hormones. And FSH is a follicle stimulating hormone in both male and female. FSH from the anterior pituitary stimulate the conversion of the primary spermatocytes into secondary spermatocytes. That is a secreted anterior pituitary hormone. Okay. In the seminiferous tubules of the testes. However, for the complete formation of spermatozoa in testosterone is needed. And follicle stimulating hormone initiated the proliferation process of spermatogenesis, and testosterone does the final maturation of spermatozoa. That's why oligospermia cases we need mid-fertility investigation. At that time we go for free and put the testosterone, FSH, and LH. Most of the time, doctor confused why you are talking for FSH test for this. No, if you want to see oligospermia, angiospermia, you should have at least know the things. What investigation you can go ahead along with this semen analysis. Now, my dear friend, already we covered hormones in most oxytocin and prolactin, and all these are oxytocin secreted by posterior pituitary, prolactin by anterior pituitary. Target tissue of oxytocin is uterus and breast muscles in the female. Prolactin, mammary glands, breast. These 2 hormones is basically for This what you should know. Nothing more. Oxytocin, uterus and breast muscles. Prolactin, mammary gland of the breast. Oxygen causes muscles contraction to expel the baby, expel the milk in the breast for the baby, and prolactin stimulate the milk formation. These are the things once you know. These are the basic happy chemicals. Dopamine. How to increase the dopamine naturally? Produce in your brain by keeping your mind cool and calm. Joy finding. How that you are to learn in Sunday meet. That is about 10 a.m. start and 12 p.m. stop. Every Sunday we started these activities. Oxytocin is safe for social bonding. Serotonin, social dominance, and all. Endorphin generally is pain relief. Endorphin hormones. These are very serotonin is a mood elevator, sense of well-being, social behavior, appetite, sleep. Serotonin is dopamine, motivation, concentration, learning. Dopamine, oxytocin, arousal, bonding, trust. Endorphin, pain management, feeling of euphoria, pleasure, and all. Okay, female sexual problem is nothing more but this frigidity because of male partner is not stimulating the clitoral part. Second is that the man need other caring factors, psychological factors, and other things. Now, diagnosis: you have to avoid smoking, you have to avoid alcohol. This can add on your treatment part. Naveen, question? Now, ED and this is over. History taking is over. Similar history taking, but you have got love mapping part and other history taking, and these things we covered. Now, my dear friend, we are already near to closing session of half hour remain. We will complete in half hour. Whatever we can do it best. Fitness and physics is very important. What is the fitness? Coffee, black coffee. What is fitness? Ability to do the routine task is called the fitness. If your patient can take the bath, he can walk, can go for toilet, this is fitness. Physics is the safe structure form of the body is called the physics. Physics needs exercise, parameter of physical health, good nutrition, proper rest and recovery, normal activity. Factors of health and fitness, endocrine system, performance, recovery, nutrition, training, fitness, aerobic exercise, anaerobic exercise is made, lifting exercise is anaerobic. There is no air is utilized. Aerobic exercise, more oxygen, air is utilized, like dancing, walking, treadmill are aerobic. Both is important in all, because every 10 years, why you look older and older every 10 years? Because of lack of protein in your muscles, and you need anaerobic exercise, that is weightlifting and other things along with this. Now, nutrition is very important. Your diet prescription is a part of our treatment program. Macro is carbohydrate, fat, and protein. Micro is the vitamins and minerals. Diet prescription varies from person to person, and there, if the businessman, politician diet will different, athlete diet is different. Film star required physics, more exercise. That once you know, write your goal, the health, how much percentage you need, fitness, kitna, physics, total should be. Suppose the patient is a senior person, about 60 years, need nutrition, 80% nutrition, proper nutrition, proper exercise 5% only, rest and recovery 15%. Those are middle and nutrition 60%, exercise 30%, model and other things. Rest and recovery 10%. Physics, nutrition 70%, exercise 20%, rest and recovery 10%. These are basic formula. What is the weight loss? Loss of water, fat, muscles, or anything from body. The weight loss. Weight loss happen voluntarily, diet, exercise, and rest. You can reduce the weight, but involuntarily illness. If diarrhea, lose motion, the weight loss. Means weight loss is a misnomer that with the fat loss. Our Sunday meet is only for the fat loss. How to fat loss? Same weight, but you lose the fat. Is also best things to reduce the more pressure on the heart. What is the fat loss? Fat loss is the reduction of body fat, means the loss of visceral fat, subcutaneous fat. Fat loss happens due to voluntary, only diet, exercise only. Fat loss not due to the diseases. Always remember. If you know some principle diet that you can, just remember this one slide. Your body is just like a factory, and you name whatever the factory cost of your factory. Suppose my factory, my body costing is 100 CR. So then you must have good raw material. My mouth and all whatever I'm using it, do it minimum 32 times, and salivary gland will secrete, and esophagus to stomach and duodenum there comes. Here all protein, carbohydrate, and fat is converted to glucose, and the glucose is absorbed. If it is absorbed and then it goes to the liver, if it goes to liver, what is the head office, and it distributes your glucose everywhere for the brain, for your small intestine, for your lungs, for everywhere, heart and everywhere. Suppose it's more, then what we do if your factory is manufacturing more than its limit, you store it. So our liver asks, store this more glucose that's stored in the form of fatty tissue. That's why fat is not the cause of increasing fat in your body, fatty tissue, but the glucose is the main cause. Whatever you are eating, one falka having 5 teaspoons, one plate of poha is 5 teaspoons of sugar. You don't need the sugar more. You have to reduce the sugar. If your patient stop eating the sugar, you can reduce your weight fantastically with more vegetables and raw. How much I told you. This is the way you can advise mechanism of weight loss. Fat loss. Sorry. Weight loss is also a misnomer, but it is used in practice. The fat loss. Type of nutrition is over simple carbs. Simple carbs, low glycemic index. Now you should know what is the glycemic index. You always eat low glycemic index food in your diet for better. What are the that you have to teach? That we are taking various classes in our Sunday meet program. It is a very good for your patient. Ask them to join. We will send you link and help them to be better with their medicinal line of treatment is the same. Whatever you are prescribing or your consultant is prescribing, remain that medicine, but do the lifestyle modification, diet program, exercise, mind control, and other things together to reduce the glycemic load. Once you know this much, you reduce the cholesterol. My cholesterol was high, now is normal. That is very. How to know whether you take the lipid profile of your patient and find out the triglyceride. Here the triglyceride is 208 total triglyceride, and divided by HDL, high density lipid, is 35. The ratio should be below 3. Is a 5 20 is prone to be hypertension or cardiac problem. Patient may die anytime, 3 to 4 years, 5 years, maybe extend to 2, 3 years more. But if you reduce it, means patient will remain normal and he can have the 100 years or 110 years like that. So there is very important to elaborate the things. With high, low density lipid is not good. HDL is very important. HDL is very important. Now, and this is C. This is fatty, and one is normal body fat. It's 20% here, fat is 35%. Same weight, same height. 130 pound, here is 130 pound. But body fat is perfect. Keep exercise, diet control, and everything, and looks like slim and trim. Same weight. This we want each and every case. Now you know the types of fat, trans fat, saturated fat, unsaturated fat. I'm not going in depth. You read it. Everything is mentioned. Now, what is the omega-3? It's very good for healthy disease. This is most of the time, most of film stars increase their weight as per the need of their role, actor role. Fat mostly is below 20% is always best in the male, and female below 25 up to 25 is okay. More than always 20, 25 for female, 20, 15 to 20 for male. There is various type of food, vegan food, only they eat the vegetables. Lacto-vegetarian, they take the milk. Vegetarian, they take the eggs. Pescatarian, they take the fish along with this, all about. Non-vegetarian, they eat all about to non-veg, but chicken and mutton and all. These are why, because vegan is a very common now. There is in yes, if you go to Canada, then they have vegan restaurant. If they don't take even milk, animal milk, they feel that the milk also transfers some diseases from animal to human being. So it is better to stop that. Diseases. Vegetarian eggs. Anyway, my dear friend, we cover most of the factors, and we are soon like all the hands-on training. You got the idea what I'm going to take a hands-on training program. And nothing is the exam is nothing like that. Everyone in the same boat. We just we have a talk what you are doing, what your ideas, what you for prospering positively. Because we want new ideas. Innovation is nothing but the ideas. Ideas page you. Or if you go for doing same thing, you're getting bored. You have to change it, make it multi. Those who think.
Sir, can you tell
out
us what the schedule will be like? Like when we will start from 27th onwards, when we will start in the morning and when we will end?
At 10:30. Yeah, we will start at 10:30 because I requested by Dr. Gupta. I think Gupta is there. कि सर आप start करो जल्दी से. So 10 a.m. is okay. So I will come 10 a.m. Otherwise, I am coming 10:30. Mostly I am coming 12 p.m. So I will come earlier in that time. So 10 a.m. too is okay because your breakfast. Most of the hotels provide the breakfast. And after breakfast, 10:30 is the ideal time for everyone to attend. It's okay?
And yes, sir. And when will
10
it get
o'clock we
over?
are okay, sir.
10 o'clock.
10 is
Okay, I
fine.
will take 10 o'clock. Those are coming. But you must come. Otherwise, you are not coming. I am getting
Yes,
bored
sir.
here.
Okay.
No student. I am sitting alone. That what is use then? So I want everyone. We will start other discussing part, other things, whatever. Ani, you everyone ask some queries, some questions. Everyone. That is the only exam. What you ask, how many questions you ask, means you are more and more marks you are getting.
So
When you are
when will
really
we
involved in
end
that,
the
you learn
sessions?
something you want to learn. Desire is very important. Yeah. We will end and 26 को आ रहे हैं आप 26 नहीं 27, 28, 29th at 5 p.m. because most of them having a they are departing at around airport and other things. They some may go earlier, some may whatever. At I'm here up to 7 p.m. every day.
Okay, sir.
You decide. I don't mind. If you want, you can stay up to the 7.
Okay, sir.
And if you want something add out of that, because I want medicinal part, you know very well, everyone. But we should know the other things to be give the results to your patient. That's the
So
idea.
the
How we
counseling
make them
part,
normal.
basically patient
Ah,
counseling, the criteria, basically the
yes.
scientific criteria, the psychiatric
Yeah.
angle of it, that I think we all need to learn a bit, like when we are all there together,
Nice.
how to
See, my dear
counsel a
friend, if you
patient.
go for the psychiatric line of treatment, then you forget about what is the counseling. No psychiatrist is doing the counseling, first things. Psychologists are doing counseling, but they are non-clinical. That's the problem. My dear, dear doctor, what's your name, doctor? I forget.
Anand.
Hmm. Anand, Dr. Anand, forget about all these things. What I'm telling you, simple to know the person's mentality, mind. Mind reading आना चाहिए आपको. How to know the mind reading? I will ask you which 4 color you like most. I will say you your whole psychological treatment. Psychology,
Hmm.
what is your mind? How is your nature? What? Red, yellow, green, and blue. Which 2 color you like most? Red, yellow, green, and blue. I'm repeating again. Red, yellow, green, and blue. Tell me, Anand.
So I would say red and blue.
Blue. Okay. Now say red color is the indication of dominating nature. Very anger. They want who can prove. Same things. किसी बाप की नहीं सुनेंगे वो. Red color. And second is what you say? Blue
Blue.
or blue. Blue is what?
Blue.
Sky blue. मरने
Blue.
के बाद अपन heaven में जाते हैं. Sky blue. After that death we go to the heaven. Sky blue means perfect. आपको परफेक्टनेस चाहिए और इसमें आपको डोमिनेटिंग नेचर है. आपको वाइफ ऐसे झेलने वाली चाहिए, नहीं तो अदरवाइज दोनों आ गए तो दोनों की कटाकट हो गई. मे बी एनीथिंग प्रॉपर. दैट टाइम यू नीड टू डू मोर
हाँ वो तो सही
मेडिटेशन,
है सर.
रिलैक्सेशन. हाँ, व्हाट हैपेंड?
हाँ, वो सही है.
हाँ सही है, तो
सही
मैं
है.
उसको वो सिखाना है आपको. और ये लेके नहीं बैठना है.
हाँ.
आप साइकोलॉजिस्ट के पास भेजेंगे. मेरे पास साइकोलॉजी पहले भेजता था. 50,000 खर्चा किया, 1 लाख खर्चा किया, कुछ फायदा नहीं है. और ये 2 मिनट के 10 मिनट के आपके काउंसलिंग से फायदा हो रहा है. तो यू यूज द ट्रीटमेंट लाइक मॉडर्न थेरेपी, लाइक एलोपैथिक वे काउंसलिंग. दिस वे एडेड काउंसलिंग पार्ट. We will teach you how to go counseling. Very
Okay,
easiest way.
that is what I'm saying, sir. हाँ. वही थोड़ा सा
But
we need to learn.
if you say according to psychiatrists, according to this, nobody knows how to do the psych. That's why this program is पैसा वसूल program. You
Okay.
have to give minimum time, maximum cure
Like
rate and result. We
if
want result.
because this is a it's a course on sexology. I mean, we might get patients like couples who are disagreeing. So how to approach those patients and how to counsel them?
अरे कुछ नहीं. Forget about partner. They will take their own partner care. There may be multi partner patient. Patient comes to you, you treat the patient only. How to treat?
So
We
वो
will
नहीं बोल
teach you.
रहा हूँ sir. I'm saying if both the people come together, like a couple comes for a couples
बहुत अच्छी बात
counseling
है.
session or something. हाँ. तो फिर
So we
कैसे
are going
handle
to
करें?
teach you. That's why you will hear. We will take one demo of 15 to 20 minutes. Then everything will be
Okay,
clear.
sir.
Okay, welcome. Now workshop is over, my dear friend. Balanced diet is over, and psychological counseling and other part we are going to take in details during our hands-on. And these are the session 1 is over. I like to give the session 2 counseling. What is the counseling? Always remember, counseling is nothing. Many people think counseling as giving advice of offering solution to the problem. However, counseling is neither of this. It's not the medicine, not the cure. It is something you change the behavior of the patient. Is a counseling. अंदर से लगना चाहिए, नहीं मुझे ये खाना नहीं चाहिए, खाना चाहिए. ये खाया तो मैं मर जाऊंगा, ये डर रहा, मैं वो खाऊंगा नहीं. तो that's the things. I reduce my weight because I know if this come on my heart, I have to go for the cardiac problem. Then my thing blockage and I can die. That idea, if I got it, I reduce my 10 kg weight. I am now reduce my blood pressure medicine. I'm getting hypertension. My doctor said no need of medicine. You just live with your lifestyle modification of diet pattern. This is the cure, my dear friend. Medicine is not the cure. Anyway,
Sir,
subconscious mind.
we have
Yes,
reading about Plisset model, Sunset, that
yes,
couple
yes, correct.
therapy.
Yes,
You will
yes.
be
That we
teaching
are
that, sir?
taking everything. Yeah,
Okay, okay,
everything. You are just
okay,
new. Just we are giving ideas to. These
okay,
are
okay.
ये पुराने खोड़ है सब बहुत पहले से आ रहे हैं आप तो अभी 2 दिन से
Acha,
आ रही
acha.
है
Acha. Sir,
डोंट वरी अबाउट
injections also you are giving, sir?
yeah
Intracaverous
we will teach you
injections?
everything
Okay,
आपको
okay.
whatever you want to ask me that day
Okay, sir.
25
Okay.
क्वेश्चन पूछो आप ये लिख के लाओ ये मेरे को सीखना है ये मेरे को समझना है ये मेरे को सीखना है whatever I know I will explain you what I am doing that practical
Okay.
whenever I studied in the depth what are side
Sir,
effect priapism भी होता है
the equipments you are using, which you have yourself made, is it available to
no
buy
not
and all,
not
sir?
not not shockwave therapy I am not made that is the
Okay,
only
okay.
meridian stimulation I asked my company if they
Mm.
manufacture it for the US company and all they prepared
Uh,
some changes for that day and they provide you or whatever we provide to my patient also
acha. We can
I
buy
will
also,
tell
sir,
suggest you
models and uh,
yeah you can get only the meridian stimulator at my center and we will
okay.
give them in concession rate whatever 15,000 का 10,000 तक मैं दे दूंगा आप स्टूडेंट लोगों को लिए
नहीं
अ,
सर, ये जो
बाकी
शॉक थेरेपी वाला आप बता रहे हैं और
नहीं
मॉडल्स
सॉफ्टवेयर
है.
थेरेपी नहीं सॉफ्टवेयर थेरेपी रिमेम्बर फर्स्ट सॉफ्टवेयर थेरेपी यहाँ का आप देख लीजिएगा उसके बाद में जो भी यूनिट आप ले रहे हैं कोई यूज कर रहा है उसको रिजल्ट कैसे मिले वो देख के तो मैं तो चाहता हूँ यहाँ पे जितने भी जेंट्स आएंगे अभी हाउ मेनी आई डोंट नो प्रीवियसली वाज 10 नाउ हार्डली आई एम गेटिंग 5 थम्स अप एंड इसमें भी डॉक्टर परुल सेठ की आई कांट कम सर व्हाट टू डू मैं ओके व्हाट एवर यू वांट यू डू इट आई एम रेडी फॉर दैट अब मैं क्या करूँ यार तो आप आएंगे तो आप समझेगा तो अब भी आप आएंगे ना जब देख लीजिएगा नाउ यू यूज अकॉर्डिंगली और मेल डॉक्टर से मैं तो बोलूंगा वो अपना शॉकवेव थेरेपी यूज करके देखो सुबह शाम यहीं और उनको 3 दिन में क्या चेंजेस मिले वो लास्ट में बताइए कि व्हाट शॉकवेव थेरेपी हेल्प्स हाउ मच परसेंटेज हाँ यू यूज नहीं योर यूनिक में रूम बंद कर लो आप करो मैं बता दूंगा आपको एक बार ओके प्रैक्टिकल इज वेरी इंपॉर्टेंट थिंग्स counseling is over now assignment peaceful but this I mean evaluation we will send you again and we will give that time all these things to you counseling part आपका पक्का करवा लेते doctor just now told by raised some query about explicit model permission patient का लेने का P for limited information आपकी information डालो उसके क्या information है करेक्ट करो उसको specific suggestion दो intensive therapy दो either प्राणायाम मेडिटेशन स्ट्रेस मैनेजमेंट दो या शॉकवेव थेरेपी दो या पीआरपी दो लाइक दैट सेक्स थेरेपी दो and now this part is over of personality and this is the way personality evaluation chart you have to make on paper one thing is strength and weaknesses now in this case there are 40 marks this evaluation show that the popular is 20 powerful is 14 means is a popular and powerful personality is a dominating God-given gift. You can't change this nature. Here, peaceful is less. You have to increase the peaceful part. And perfectness is less. You have to improve the perfectness part like that. तो ये आपका सबका इवैल्यूएशन कीजिएगा मैं आपके लिए सबके लिए क्वेश्चन तैयार रखूंगा so that you can keep one things from here so that you can do at least ask your receptionist to do it. If you don't understand, ask them to join free of cost there. They are not going to interest in joining the Sunday meet. Those are patient, mostly want to cure. They may join. Anyway, I'm sorry is very important. Ask, learn to say sorry. Sorry बोलने से कुछ नहीं होता बिगड़ता है. Sorry बोलने से प्रेम बढ़ता है. Urinary bladder meridian, kidney meridian is very important for stimulation. See, kidney meridian, urinary bladder, all the back is stimulating. All the ear to ear, kidney meridian. Ear, again, lung meridian is a asthma patient and all energy is required. Large intestine meridian, these are always meridian. ये भी मैं आपको दे देता हूँ दे दूंगा आप अपना एक लैपटॉप और एक कोट लेके आइए ना व्हाइट कोट होगा तो मोस्ट ऑफ द टाइम पेशेंट विल नॉट अलाउ if you are not wearing the white coat. These are bark flower remedies, everyone can keep it. Suppose your patient comes, smiles, and hide inner worry. बाहर से हंसते रहेगा और अंदर बहुत कुछ उसका घुटन है, एग्रीमेंट दे दो उसको, बहुत अच्छा लगेगा, ड्रॉप से एकदम अच्छा हो जाएगा। बहुत एक्साइटमेंट है, अननोन, अप्रेंशन, फियर, एस्पेक्ट दे दो, खत्म हो गया, ठीक। देखे देखो, रिजल्ट देखो, बाद में आप बताइए how it is effective, along with your line of treatment with allopathic, whatever you are doing, Ayurveda, homeopathy. Now I'm not taking your much time. I will end the class because I'm getting it. Already I covered. I started at 3:30, 4:30, and 4:30, half hour. Okay, fine. Just we go ahead. What the researchers said so far. Most of the researchers, their opinion about okay, sexualism, male desire, erection, ejaculation. He added something. Okay, we will take it again. One implant is for the urologist. We'll do the implant. Stop and start techniques. Everyone know. Stop and point. Retarded ejaculation, retrograde ejaculation, delayed ejaculation, inhibited ejaculation, painful ejaculation. We will discuss and we will have what to do, what not to do. We are going to discuss in details. Impotency, masturbations. Then because and if possible, try to attend, go on attending, because our body, our body is made up of earth, air, sun, water, whatever there, the same thing in our body. We representing the earth, whole universe, and how to treat them, and these things, training program, conscious mind, subconscious mind, we are already covered. Now, these are the ways. Various acupressure helps, lot of treatment and massage helps. Most of the time, these are the stimulating and to increase erotic zone stimulation in the body and all. There are a number of things. Everything is in my book. I send you. I don't want to repeat again, send to you. Sometimes the people say, okay, some are senior, genius, they study, they want to study, they take all Xerox, everything, print out. Dr. Gupta has recently joined season. I have taken all first Dr. I have taken every books and printed one and keeping for my study purpose. Anyway, very good. You should learn and you utilize the things. If you learn it, you can utilize. What is this? Learning is earning. Learn जितना करेंगे उतना ही आप earning बढ़ते जाएगा. Anyway, these are the things we cover here. Lot of things, many things. And consent letter is very important. Everyone must take the consent letter whenever patient comes in your cabin. Now, these are the various. There are around 2,000 slides, and every slide is around whatever my books, 10 to 15 books. Some things maybe there because some all we have used everything, all the ChatGPT and everything we have taken use of Google, free images and all. And sometimes someone asks any this thing, we request them. This is the study material we are using it. If you don't want, we will remove it. Nothing more. This is the way what we covered today. Thank you very much. And today's recording, if you want, I can provide you, no problem. I will send you. Thank you all. You can get it the link. Thank you very much. We end here. We'll meet.
Sir, can you please share your clinic's location, not the live location, the location on the group?
I can share it. Yeah, I share it. Again, I will share you. Don't worry, in the group. Yeah. I'm going to share everything on the group. Just chat, write down what you want, and we will share it. And I request everyone, please give their name, because my previous assistant was looking after this all documents. She's married and she left. Just write down your name and which degree you are applied, so that I can find out. It's easy for me finding the which and very complicated like that. Okay, so accordingly we will keep it possible. Otherwise, I do search and I do prepare your all certificates and all. MCQ, you prepare the MCQ, you bring the MCQ with your name, that will get here. Those who are need some thesis, write down the thesis, that will help you a lot. Keep the two, one part you can keep, or if you prepare it digitally and get it printed here, 600 to 1,000 rupees, take it here. We will give the address, you go there and print it after 7 to at 9, 2 घंटे में सब होके रेडी होके आपको मिल जाएगा. इस तरीके से आप बैठ के करवा सकते हो. Anyway, so we will meet you. Thank you very much. Now I'm stop sharing कर रहा हूँ. Now stop streaming कर रहा हूँ. Okay, fine. Soon we are meeting on 27th. Thank you very much. हाँ,